This is the Professional Hypnotherapist Podcast, a production of the European Association of Professional Hypnotherapists. That's EAPH.ie.
Hello and welcome. I'm your host Aidan Noon, and today we hear from John Scanlon, hypnotherapist and organiser of the Irish Hypnotherapy Conference.
Okay, John Scanlon, thank you very much for being a guest on the Professional Hypnotherapist Podcast.
Thank you, and lovely to be here.
Now, John, you're a hypnotherapist practicing in Gorey, isn't it?
Yes.
County Wexford.
Yeah.
And what was the motivation for you, John, to get into hypnotherapy and hypnosis per se?
It's an interesting question. People ask me that from time to time, and I about 15 years ago, I got into meditation and into Reiki and into that kind of energy. And about 6 years ago, I discovered hypnotherapy and hypnosis. And I discovered that the transitions and the changes that people made were much deeper and much more, they're much longer lasting. Because I had always been fascinated by the mind, but I didn't necessarily know a whole lot about it until really about 6 or 7 years ago. And the idea of the conscious mind and the unconscious mind, and how the changes are the things that affect us in our youth are what actually drive us to a large degree today, unless we're actually aware of it. And I suppose there was some personal stuff that I was going through as well that hypnotherapy really helped me with. And then I just decided to go into it full time. Well, study it in depth full time. As I said to you, I'm not full time working at it. I kind of work at it 2 to 3 days a week, as it is at the minute. So so that was my motivation for getting into it in the first place. And I studied with Carol Anthony with the Institute of Clinical Hypnotherapy in Ireland. And after that, I actually studied with Mike Mandel in Canada. And it was a different type of learning for me from what Carol Anthony would have done, which was great. I absolutely loved it. I still use it all today. But Mike introduced me to a different aspect of hypnotherapy, and particularly Ericksonian hypnotherapy that I actually kind of really, really like. And I actually went to, Mike had a 2-day event in London in 2018 or 19. So I went to that, and I absolutely just loved it, made so many connections. It happened to be around the time of the UK Hypnosis Convention at the same time. Went there, and so the rest, as they say, is that's where the journey all began.
Good. And indeed, and no better people could you have trained with.
Yeah.
The people you've described. What type of transformations have you witnessed as a therapist with clients?
There's been some amazing transformations. There've been people who've been, you have the smoking, obviously, you have the weight loss where people have been losing the weight. So when I'm working with weight loss patients, or I'm working with, and most of what I would do is work with anxiety anyway, but a lot of the weight loss would actually be anxiety driven in the first place. It's kind of stress. It's all stuff that's coming from the past. It may have been a comment somebody said to them a long time ago, and they're, for that reason, and they're not even aware of it. And it's suddenly there's an insight. It's like a light bulb goes on, and it allows for those changes to take place. In most cases, what I see is just literally people putting that light switch on, where they can go, oh, you might do something very simple. Would be, say, if you were to do, let's say, a stiff arm exercise with somebody, where their arm is completely stiff or their hands are locked together, whatever it is, and then you go, right, just relax your arm. And you say, did you have a bar in your arm? And they go, no. So, right, it was just a thought. And it just opens the doorway for all these other transitions to take place. You know?
And opening the doorway is indeed a very apt expression, because you specialize in anxiety
Yeah.
in your practice.
Yeah.
And what was the motivation, if I may ask you, to specialize in anxiety in the first place?
I knew a lot of people who I would have had a slight touch of it myself. My mother would have been a very anxious person. So I would have been familiar with it growing up as a child. And then I was working with a lot of people who were anxious. And I saw the effect both on them and on those around them, actually. That's the other side of it, because I think sometimes what us as therapists forget is that while we make the change to one person, it actually ripples into the rest of their lives. And people see a difference in that person. And particularly when someone is anxious, it's when the anxiousness is gone and they're more relaxed about life, all of their environment becomes more relaxed as well. So you'd often get feedback like that.
And to use an expression, there's a certain freedom that they latch on to, that freedom that was just sort of perhaps locked away.
Correct. And I mean, I think the beauty of it is no matter what the techniques that you use that make somebody or that help somebody, because I think one of the greatest learnings was that we as therapists don't actually make any of the changes. It's the client that makes the change. All we can do is provide words or tools or techniques that actually help them make that change. And it's almost like sometimes they need a various different technique. What might work for one won't necessarily work for another. And that technique just gives them the freedom to make that choice. That choice that, oh, I interpreted something that happened way back when as this, but now that I look at it as an adult, as I am today, it's like, oh, why did I do that? And it's like the foundation of that belief just disappears and it all starts to crumble down.
And I suppose it's the job of the therapist to be dynamic to such an extent that you find that key.
Yes, absolutely. I have been described as a very perseverant person. Clients have described me like that, yes.
That's good. Now, John, in your relatively short time in the hypnotherapy world, you have made huge leaps forward in terms of that you're now organising the Irish Hypnotherapy Conference. So what's the motivation for that?
It's really, really ironic, Aidan, because, or not ironic, but like 6 months ago, this actually didn't exist. This was barely a concept in my head, barely. And I suppose, I mean, I described that time when I went to London and I had the few days with Mike Mandel and Chris Thompson. Absolutely loved it, the in-person rather than doing stuff online. It was the same when I was training with Carl Anthony. It's the in-person. And I also went to the convention for a couple of days at that point in time. I met loads of friends, loads of new people, and I just loved being in that. I mean, you're doing something that you love. It's very powerful and affecting and helping people to change. And I kind of went, okay. So particularly during COVID, which most of us would have found, fairly difficult, the restriction of freedom and all that kind of stuff. A lot of the friends that I'd made in the UK were great because we were zooming in. We were doing a lot of work with each other as groups or whatever. And then I went back in last November. And they had the second one my second one was last November. And it's 3 days. It's obviously a fairly large event. I don't know if you've been, but it's 3 days. There's 300 or 400 people there. There's workshops from 8 a.m. till 6 p.m. for all the days. And I was kind of sitting having coffee with two friends, and I went, oh, we really should do something like this in Ireland. And literally, it was like that light bulb that I described with clients, and suddenly it's the light bulb with me. And it was there. It was just kind of like there. So I came home, and Mary Gregan is the lady who runs the PAMS Health and Wellbeing Centre where I practice, and Karina McAvoy does as well. And I said to Mary, she is a hypnotherapist. Oh, apologies. I said to Mary, am I mad to do this? And she went, no. And then I made another call to Ken Falconer, who was one of my trainers with the Institute of Clinical Therapy. And he says, no, you're not mad either. And I went, okay, there we go. So I had met Freddie on a number of occasions, and then I met him again in January in Dublin. And he said, yeah, I'll be there. I've trained with Carol Smith. I know Carol quite well. And Carol Anthony, I would know because I would have trained with Carol. Stephen Travers would be, obviously he's part of the EAPH. He's also trained with Carol in the UK. He'd be part of the Hypnotic Masterminds group that exists over there. So suddenly it just all came together. And for me, really, it's, I suppose it's three things. It's an opportunity to learn and not have to travel across water to get there, which is the first thing. It's a chance to meet both people I wouldn't have seen in a while in a hypnosis related function, because there's so few events here. And also to meet loads of new people, like you and I hadn't met until this morning, and I know it's virtual, but
yes.
So it is, and when people meet, and it's one of the things I like, and Freddie said it to me actually. He said, so much of the enjoyment and the connections, and actually even the expansions that take place within people, whether it's ideas, whether it's concepts, whether it's new ventures, whatever it is, they happen around coffee, around the lunch, around, so yeah, there's the motivation, and there's the reason why. It's the first one. There isn't, if you like, a national register of people. So Stephen McGill, who's a marketing expert, has been doing all of my Facebook stuff, thankfully, God bless him. So it's reaching more and more and more people. And all I can do is let people know it's there, and however many want to turn up and avail of it. Let's put it this way. If I wasn't organizing it, I'd still be going.
Excellent. Now, you mentioned the speakers
Yes.
on the conference. Just give us a list again, if you don't mind.
Yeah, absolutely. So there is 8 speakers, so it's over 2 days. It's Saturday the 20th and Sunday the 21st.
Okay. So there's 2 days.
Pardon me?
There's 2 days in it.
2 days, yeah. And there is a dinner on the Saturday night.
Okay.
The speakers are there. There's Ken Falconer, who has his own practice up in Larne. He's a trainer. He does a lot. He's a mind coach as well. So he does an awful lot of athletic training and stuff like that. There is Stephen Travers, who you know very well. And Stephen
is originally from Dundalk.
Absolutely, and he'll be demonstrating the havening technique on the day. He's a world's expert in that. He's one of the people go to. Then there's Jason O'Callaghan. Jason has one of the largest clinics in the country. He also has an entertainment business as well. He manages to balance the two between them. From a business perspective, and he will speak a lot about his business model. And then there's Freddie Jacquin, who will be the last speaker on the Saturday. And I'm just so looking forward to Freddie. And I saw him in January in Dublin, but I just always find him absolutely amazing.
Yeah, we had Freddie do a CPD for us.
Right.
And he's also been featured on the EAPH podcast. Sorry, continue there.
Yeah, yeah. On the Sunday then there's Karina McAvoy, and she's going to talk about the children and adolescents and how she both enjoys that and works with it and all her tools and techniques. And it's actually really interesting because I was talking to Freddie on one of the days last week, and Freddie had done a whole load of a series of stuff with children. So the two of those will link together on that and see where that goes. The Carl Anthony, who has his Carl Anthony method, which he uses to, again, it's all trauma release. Then there's Stephen McGill, who's a marketing expert.
Right.
And there's an element of both business and marketing here, and it's very specific, and I'll come back to that then. And then you have Carl Smith, who has the UK Hypnosis Academy. It's a really successful. He will both do some demonstrations in terms of kinetic shift, which I use, and I really, really like it a lot. It's very effective. And his mental welfare coaching, which he does. But he'll also talk about business, because I think that's one of the things. And it's funny because I had a conversation with Stephen McGill, and I can't speak for other training schools and other colleges, but when I was talking with Stephen, I said, your stuff was on the very last day, and your stuff was absolutely brilliant. And I've gone back and I've looked at it since. But on the day, we also had our exam. So we weren't actually really focused very much. Yeah, that's kind of a problem we always have. So, but in a lot of cases, as therapists, we love to be therapists. We don't necessarily want to do the business aspect and the marketing aspect of it. And it's really
important, John, because that's a really important point you made, because, there's a certain, what would I describe as an altruism about therapists. They want to help people.
Yes.
And that's the primary motivation. But also we must realize that behind it all, we have to earn a living.
Absolutely.
So would you speak to that in terms of the business and marketing?
Yeah, I mean, I completely agree. And I am a business person, right? I said to you, I'm an accountant. That's actually what I do. So I understand finance. I understand all of that kind of stuff really well. But when I get into, if you like, hypnotherapy mode, I switch completely, and I know a lot of therapists exactly come from that space of, it's altruistic. I just literally want to help that person. And that gives that element of rapport. It's perfect. It's beautiful. And it's the way it should be. You're there for the client, and the client is the most important aspect of this. But I'll sometimes use the analogy of a mobile phone, and I'm holding it up there now, but what's the thing we do to keep that mobile phone healthy and fit? We charge it, we plug it in at night, we give it what it actually needs. As therapists, we need that. So we also need to live.
Yeah.
So therefore, to live, there has to be a business model, or the actual practice doesn't survive.
Indeed.
So that's the reason behind it. And in a world where marketing is absolutely key, of getting out that people's services there, what it is it does, and how it can help people to transform their lives. And it's not just to release that individual fear, or stop that smoking habit, or lose that weight. In a lot of cases, it can be used, and I love the model of, if you like, a coaching model, and using hypnotherapy as part of that coaching model, where you might have, say, a wheel of life, where you've got your work, your finances, your family, and using hypnotherapy as a circle to boost each and every one, so that the quality of your life improves.
It's almost an holistic approach.
Yes. Yeah, and hypnotherapy can be used for that as well. Because we know that the power of the changes that are made through hypnotherapy, they're deeper, they're far more effective, and they last.
Yeah.
So if you can get somebody to believe in themselves, who can suddenly start to get fit and can start to manage their finances better and earn more money and have better relationships at home, and on it goes.
Absolutely. Now, you mentioned the conference is on 2 days.
Yes.
So would you give us a rundown on, we say, day one, I presume is the Saturday?
Day one is the Saturday, and actually I gave it to you in the order in which they appear.
Okay.
And I suppose the other thing that just to mention on that is and I've mentioned this before just in some of the stuff that I've done, but there is the whole thing of meeting new friends, old friends. There's also the concept of creating a community, a larger community of hypnotherapists, so that more people. So my son actually uses this lovely term. He says, not a community, an ecosystem that grows, that expands. And I really like that concept, because I suppose we all know the value of what hypnotherapy can do. And it's just making it more accessible to people. And maybe breaking down some of those barriers. Hypnosis, hypnotherapy is therapy using hypnosis. That's what it is. Hypnosis can be used for fun. Hypnosis can be used to improve people's overall well-being. So it's finding ways of just allowing hypnosis, and particularly the therapy side of that, to expand without maybe, sometimes people will come in and I go, I'm not going to make you dance like a chicken, because sometimes people hold that view. But hypnosis is and always will be used for entertainment. Even when you get a group of therapists in the room, you'll find someone's hand is stuck to a table, or someone, because we do that, so it is to build an ecosystem that can allow hypnotherapy to become a more popular tool and that's more accessible to people. So,
sorry, go ahead.
Yeah, all I was going to do was do the order, but if you want to ask me on that, please do.
The order, yeah, please, yeah, go ahead.
Okay, so it starts at the doors open at 9 on the Saturday morning, and it's kind of half an hour or an hour of registration. It's half an hour of registration. So the first speaker is, I think it's 9:45, and we're just balancing all of the schedules now. And it's Ken Falconer. He'll open it. Ken will be about an hour. He'll talk about his business, and particularly about both the coaching aspect of it, but also the measurement aspect of it. And I'm interested to hear that, because it's interesting proving our stuff and measuring. And there's actually more to come on that as we go through the day, because there'll be another speaker who will be talking about that as well later on as the day goes on. Following that then is Stephen Travers, and Stephen will do the havening, and Stephen will be demonstrating that on stage. Then we've lunch. Then Jason O'Callaghan, and Jason is interesting because he has a really effective business model. But he's also going to be talking about a piece of research that they've just got published with the Mayo Clinic in the States. So he's hoping to be letting people know about all of that, and he's done that with the medical profession in UCD. So that should be another interesting part. And then the last speaker of the day is Freddie Jacquin. And Freddie's going to demonstrate the arrow. He's going to demonstrate the total perception management technique that he has. And as he said, and if anyone wants to look, his video is on the Irish Hypnotherapy Conference page. Freddie, and you'll have heard him say this many times, he does it through the power of love, creating emotion. And he's going to talk to that all through. On the Sunday, then we have Karina, and again, I think that's 9:30 on the Sunday. I should go back a step, because Saturday evening there will be a dinner, and it's a chance for everybody just to sit, converse, and all through there'll be coffee breaks and lunch breaks and all that kind of stuff. So on the Sunday then, Karina will open on the Sunday morning, and Karina will talk. In most cases, there's Q&A as well. So if anyone wants to ask questions, that's absolutely, speakers are all lined up to address any questions people have. Carol Anthony then will demonstrate the Carol Anthony method at the second part of the morning. And then we have lunch in the afternoon. We have Stephen McGill, and all of these presentations will be roughly about an hour and a half. So Stephen will cover, and he will also have about 30 minutes for Q&A. And the other side of that is the speakers are also available all through the conference. So just because someone hasn't spoke yet, or you have and you want to ask them a question, they're all there. And he will address marketing and internet marketing particularly. He works a lot with therapists anyway, so he's very good at what he does. And then it'll close with Carol Smith. Carol will demonstrate the kinetic shift. He will demonstrate, he will talk about his mental welfare coaching. He deals an awful lot with trauma, particularly post-trauma. He drops the D completely. He says it's not a disorder. It's just post-trauma. And Carol was a former army man and policeman, and his story is very interesting about how he got into hypnosis and hypnotherapy in the first place, because he was knocked down by a drunk driver, and it literally put him into a traumatic experience that hypnotherapy helped him out of, and the journey begins. And that is the 2 days. It's until, I think it's 4:30 on Friday to give people a chance, or on Sunday, sorry, to give people a chance to go home, but there'll be loads of people still milling around afterwards for conversation. And yeah, so that's basically the 2 days. And I must admit now, I'm like a child looking forward to it. And I will say to you, the power of hypnotherapy is that if you asked me, would I even consider doing this 5 years ago, I would have said, absolutely not a chance. I'm very shy. I couldn't be doing this kind of stuff. And now you can't shut me up.
Well done, because it certainly seems a very comprehensive, list of experts in their field. Especially the fact that it's the very first Irish Hypnotherapy Conference.
Yeah, so it was. I'm very lucky with the training, and the training with Mike Mandel would have opened up an awful lot. I mean, that's where that weekend, and I think neither of them will actually remember meeting me that weekend, but I actually met both Freddie and Carol Smith that weekend, the first weekend that I was over. And then I've met them many times since. But the training with Mike Mandel and just opened up those doorways. And look, it is the very first one. I mean, I'm sure there are things that I could do better. And when it's over, we can review those. Anything that I think I might need to tweak, I'm doing it as I go along. But the idea is really just to get therapists together, and hopefully to create an ecosystem that expands beyond Arklow, beyond that weekend. And hopefully just to make it an annual event that people can come together and celebrate hypnotherapy. Just celebrate it.
That's an excellent way to put it, to celebrate, because we are all the nature of therapists, generally speaking, we work on our own a lot of the time, and there's a certain, what would I call it, insular isolation, and it's all part of what you're doing, what the EAPH is doing, is trying to bring people together, and to support each other.
Yeah, it is. It's extremely important. It's that part. Not only do we need to earn money to live, but we also need to support ourselves and each other in the work that we do.
Now, the conference, I presume it's specifically designed or geared or directed towards therapists, hypnotherapists.
Yeah.
Are members of the public welcome?
They are. Members of the public are welcome, and anyone who has an interest in hypnosis will enjoy it. They will absolutely enjoy it. But it is primarily aimed at hypnotherapists. But anyone who has an interest in hypnosis, absolutely. I know, and all I can reference actually is the London one, because that's the only one I've actually been to. But that's open to everybody. It's a wonderful atmosphere that's there. It's everybody sitting down and learning so many new techniques. The one that sticks in my mind, and I'm not sure if you're familiar with it, but I saw a demonstration by Richard Hill of mirroring hands at the London conference, and I absolutely adore it. It's a book that he's published with Ernest Rossi. And it's an amazing, simple technique that, again, like a lot of things in hypnotherapy, you figure out logically this shouldn't work, but it really does. So it's learning those, and it really is. It's just a chance to learn, a chance to connect, and hopefully a chance to grow.
And I know that the EAPH, we will have a table there.
Yes.
Yeah. And in terms of having tables, are there any other organizations?
It's been offered to other organizations, so and I expect that they will be taking those up. Yeah, I expect they will.
Is there anything else now, John, that you'd like to, impart in this video podcast? Or
all I actually really want, Aidan, is to, as you can probably tell, I'm quite passionate about hypnotherapy. I know how effective it is, and I know the results that people get. I also know how working on your own is challenging. Yeah. And all I want is for people to experience it. Sometimes these events, they're not always about learning. They're not always about learning new methods or new techniques, but they're about exposing yourself to new people, new techniques, and seeing what works for you and what doesn't. And I think that's what that weekend is about. But it's also about having fun. It's also about having fun with like-minded people.
Yeah, that's important. I think that's really important, because it's in having the fun that the maximum learning takes place.
Absolutely correct. And that goes back to Freddie and the power of emotion, and where the learning curves, as he says, never miss a good opportunity to empower somebody in some shape or form. And emotion is always the key to that.
Wonderful. Now, John, in terms of your own work as a practicing hypnotherapist, how can people contact you?
Well, it's empowergorey.com is the website.
W-E-R.
Gorey.com, yeah. So empowergorey.com. And my phone number, I can give it to you if you want. It's 086 858 1473.
Give it again, please.
086 858 1473.
Excellent. Well, John, I really enjoyed meeting you on this podcast, because, you come across as someone who's, as you mentioned, very passionate about hypnotherapy, and indeed very passionate about what you do. And congratulations on your first endeavors in organizing the very first, I presume, Irish Hypnotherapy Conference. And many people attended.
Well, hopefully. But like I said, it's there. My job is to let people know, and just to enjoy the weekend, and to learn, to meet, and to have fun, and to support. So if anyone has any questions in relation to it, please, they have my contact details, and I look forward to seeing as many people there as will be there on the day.
Good stuff. So thank you very much, John Scanlon.
Thank you very much, Aidan. Much appreciated.
You have been listening to the Professional Hypnotherapist podcast. a production of the European Association of Professional Hypnotherapists. That's eaph.ie. Why not pop over now to eaph.ie and check out the many hypnotherapists who are waiting to hear from you. That's all for now. I'm your host, Aidan Noon, and bye-bye for now until next time.